friend had a little more enthusiasm. We're great to have him on the team. Let me just say, kind of doing the wrap up, he mentioned it, 4.5 trillion. I was looking at today, it's almost $5 trillion we're spending on healthcare. And you can make the argument, there's a lot of sites out there you can look at, our health's getting worse. Kids, 20% obesity. Young adults, 31 and under, in terms of serving the military, 31%. Adults in general, 40 to 50% obesity, and all the things that kind of come with that. And you mentioned a little bit about education. What are you doing to try to educate people? I read a book and it said, you need to be the CEO of your own health. I think some simple things like, I don't want to make too simple, but like screening, everybody getting a physical if they want. If they don't, that's their choice. But getting a test, getting the screen at the beginning of the year, January or something, where you get a physical and I got to say, I got a couple of tweaks here and get something done. But I'm curious about that. And then the other question I was going to ask, so I'll throw it out there, you can think about it, is the pay plan. I had 1,200 employees before I came here. The pay plan is the most important thing, or one of the most important things. There's a lot of other things. But the whole thing on fee for service, is that the way we should go, or should we be looking at alternatives? Because the tendency, whether you like it or not, the propensity is to move you in that direction, to do more, to make more money. I'm not saying anybody's taking advantage of it, but my point is I really do think that there should be some consideration. Some firms, I know I've got a doctor I work with, and he says you pay him so much a year, and he says, I want to see you less. So, but that's the right incentive, is treat people, treat their health, their conditions, get them better, so they don't need to be running to the doctor every couple of weeks. So, Doc, what do you think? Mr. Houghton, what's your thoughts on Dr. Houghton? Yeah, go ahead.
Yes, sir. So thank you for the question. I think you're right. I think there will likely always be a fee-for-service component and a value component. There are certain things in the healthcare that are transactional, and they will probably stay transactional, whether that's cataracts or ear tubes or things like that. I think when you look at the major costs in healthcare, it's really around this chronic disease management. And the way we can approach that and be successful is using comprehensive care teams, top-of-license work, reducing some of that regulatory burden to make it easier, offload the providers, allow them to do their job, and create the right access points. And if we can get, irregardless of what the payment model looks like, if we can get patients to the right level of care at the right time, we will see cost reductions in maintaining quality. And we've shown that in many programs over the years that we've been involved with and others here have been involved with.
Yeah, someone said like heart disease and cancer and some of these things, if you can catch it early, good chance you'll be able to deal with it and to work out. Is that your sense? Is that what you've seen? Is that the case? I feel bad for my mother. She passed, but by the time she went in and got addressed, it was stage 4 colon cancer, and never knew she had, was in that situation. She thought she had the flu. So just in the back of my mind, I thought to myself, and I had another friend, a young person at 40 years old, had the same scenario. But it just seems if you catch things early, there's a good chance between diet and exercise. So what do you do with your employees, for example, to educate them, or your patients, educate your patients? Because one thing I do see a lot more than what was 20 years ago, I got 10 grandkids and 2 sons, but the daughter-in-laws, they're into health. They don't bring the bad stuff into the house. Now, as Papa, I get a chance to take them out for an ice cream, but the bottom line is, I said, don't bring it into the house. And, vegetables, fruit, and all the other stuff. But it seems like the younger generation, because we've got access to so much good information, they're watching it, listening to it, and a lot of it they're not bringing it into the house. They're making a lot better decisions than even we did when we had kids many years ago, my wife and myself. Any other thought? What this record is?
Yes, so I agree. Preventative medicine saves lives and it reduces cost. And just like with ECAPS is earlier testing and treatment of disease. And so I think by really implementing pharmacists into those care teams, we can help to produce those better outcomes.
Yeah, it seemed pretty exciting about the idea of working together as a team. Anyway, I'd like to thank our witnesses for appearing before us today. Please be advised that members have 2 weeks to submit written questions to answer later in writing. Those questions and your answers will be made part of the formal hearing process. With that, we stand adjourned.